Hello everyone, my name is Dr. Priya Datta. I work at Indian Institute of Public Health, Gandhinagar. Today I am going to take model number 5, which is on thermal extremities. Next, this slide notes some of the key concepts that will cover in module 5. So the first one is extreme thermal event causes excess morbidity and mortality. So all adverse health outcomes are preventable. So if we take adequate measures or have a proper adaptation plan, then we can prevent those, and their lives are preventable. Workers' productivity likely to be adversely affected by extreme heat. The second one is the climate change is projected to increase health risk with more severe and longer heat waves. Larger and the older population could increase the risk of additional adverse health impact. Adaptation can reduce current and future risk in morbidity and mortality due to temperature extremities. So, the first one, understanding thermal extremes. The key concepts. The so we have divided it into two. First, the events versus season and exact health outcome. Um, a critical element when evaluating thermal extreme is to remember the difference between short-term weather anomalies versus the long-term changes in seasonal conditions. Thermal extremes, including cold and heat, are by definition relatively rare. So there's no universal definition. So what is extreme in one location is not necessarily extreme condition in someone else. Hence, the need for a local definition of what constitutes an extreme. And the next component is excess health outcome. So excess health outcome also is a critical concept. Death certificate and the visit to healthcare providers rarely include temperature extremes as an underlying cause. So it is difficult to determine the exact number of adverse health events. Instead of number of excess health outcome determines the impact of an event. This is the difference in the number of rate of outcomes during the events compared with what would have been expected if the event had not occurred. So not all observed health outcome during an event should be attributed to weather conditions. So difference from the baseline during and shortly after the extreme thermal events provide a means to measure the events severity and an opportunity to evaluate who is the most vulnerable to the event. So I will explain all these things in depth. This graph illustrates the change in global surface temperature relative to uh, to 1880 to 2020. This is the average temperature. So you can see that the mm, from 1980 the temperature is increasing across it's globally it's increasing. This schematics show how climate change could increase not only the mean temperature but also more record of hot weather and less record of cold weather. So increase in climate change will increase the number of hot days, as well as not only the compared to the number of cold days. So this figure assume the variance remains the same. The only change is a shift in mean temperature. So you may think there's a small shift, but the small shift result in increase in the more number of hot days or heat wave days. So how this climate is changing? What do you mean by climate change? So climate change is increase in global temperature, increase in duration, frequency, and extreme heat events, fast increase in night time temperature. So, however, the observation indicate that both the mean and the variance of temperature are changing. This means the curve is being flattened and extended further to the right. Right means this number of more increase of hot days. At the same time, the risk of cold weather also remains. So, though the number of hot days are increasing, but there is also a risk of cold weather. For example, I will give you an example of 2003 heat wave in India. The heat wave causes, as I say, causes excess mortality in every country that has analyzed data. So the data analysis, both mortality data analysis is very important in any city or any district across India or across globally. Then only you will know what is the risk of heat related mortality or morbidity. So as shown on the slide, the heat wave occurred in India in 2003 that resulted in more than 1,900 excess deaths in India in 2003. This is an example. So high temperature increases the occurrence of heat related illnesses such as heat exhaustion, heat stroke, and exacerbate existing conditions related to circulatory, respiratory, nervous system problems. An increase in heat wave, particularly in urban area, could significantly increase in death. This is also because of the urban heat island effect. Higher overnight temperature during heat wave are a concern for human health, as colder temperature and night often much needed to relieve for heat heat of the day. The previous side I explained that due to the climate change, the night temperature is also increasing. So the nights are now not that cooler. So your body does not cool. Women, children, and elderly are among the worst who died. So they are more vulnerable to heat wave. These images are from heat events in India. This slide also points out that while there is a tendency to focus on mortality impact of thermal extremes, these events also have a significant impact on morbidity and can reduce the productivity as people limit activities in an attempt to control the exposure to heat. So the poor and the outdoor workers suffer a lot, and their productivity also increase during the extreme heat conditions. Next slide. Uh, we have looked at an example of India 2003 heat wave. I'm interested in the recent thermal extreme you might have experienced in your own countries or your own state or cities. Um, so, uh, you, if you are from a certain city, so you need to find out what thermal extremes are you observing in your city or in your district. And have you noticed any health impact from the thermal extreme? So these two questions you need to find out from your city. So for that you need to collect the all-cause mortality data or the morbidity data. So all-cause mortality data you can get from registered birth and death department, and morbidity data you can collect from the hospital ambulance, and compared it with the temperature data. So temperature data you will get from the Indian Meteorological Department. So to answer these two questions, this section I will explain how to identify thermal extremes in your city or district. As this is a COVID time, so I thought to include a slide on heat wave and COVID. So as everyone is saying the third wave is coming, so we don't know what is the end of the COVID, so third, fourth, fifth wave may come. So, to understand if COVID has a relation with heat wave or heat wave has a relation with COVID. So, Indian Meteorological Department has predicted that a heat wave condition are likely to be severe in 2001, 21 or 2022. So, because of the increase in climate change, the global temperature is also increasing. So extreme heat wave condition might exacerbate the and introduce additional challenge for individual health workers, health facilities and communities in the management of heat wave. As government is saying and everyone is stay at home, stay at home. So there's a need for more so everyone does not have cooling facilities at home, so that and the health workers, those are working in the hospital with the PPA, they are more exposed to extreme heat wave conditions. So the severe heat wave in Indian cities could endanger the life and the health of people living in poorly ventilated, hot, crowded homes, low-income urban slum dwellers, people with poor option of self-quarantine or for maintaining requisite hygiene level. So in slum, in one small rooms, there are 15 to 20 people are staying and they don't have any cooling facilities. So during the extreme heat condition it will be difficult for them to uh, to maintain a certain temperature, so that will increase the the risk to extreme heat wave conditions. So many of the people who are most vulnerable to COVID are also vulnerable to extreme heat, including older people, those with pre-existing medical condition such as cardiovascular disease, respiratory illness, or diabetes, homeless people, and outdoor workers. Local. So Indian cities should prepare for heat wave along with COVID. So because of the COVID, we should not neglect the extreme heat condition. So another case study apart from the 2003 heat wave that I explained you, another case study we are am working on Ahmedabad heat action plan, and this is the third heat action plan of India. So just a small case study to get some idea. I will explain you about the Ahmedabad heat action plan case. So we know extreme heat can lead to dangerous, even deadly health consequences, including heat stroke and heat stroke. In the year 2010, Ahmedabad had a major heat wave, and our studies showed an excess of 1,344 all-cause deaths in the month of May compared to the year before and after 2010. Also on the peak heat wave days, that is 21st of May, you can see this red line. This is the peak and it's showing the temperature increases to around 47 degrees. 310 deaths were registered as compared to the average 100 or 100, 125 deaths on the same day, May 2010 compared to 2009 and 2011. The all-cause mortality rose almost 3 times on the peak heat day, that is 21st of May 2010. This is the first time anyone has had reported such a gross increase in mortality during the heat wave in any tropical countries. So there was no apparent reason for the great increase in the mortality except the heat wave. So this is a small line diagram. This is a small evaluation that we did, which result in the first heat action plan in South Asia. This was the first South Asia heat action plan, which we launched in 2013. And because of the plan, there was a reduction in all-cause mortality. And Indian Institute of Public Health partnered with national and international agencies and with the Ahmedabad Municipal Corporation. We developed and launched a heat action plan in Ahmedabad, as I said, in 2003. This is a simple plan, adaptation plan, when we launched in 2013. So over the past years, so we evaluated the heat action plan, and we observed that there's a significant reduction in mortality during the heat season, and there's also decrease in heat stroke cases and deaths. So we have also published a paper in 2018. So this is a link, so you can refer to the paper, and the paper we have analyzed that how the heat action plan has resulted in reduction in mortality. So the heat action plan has four simple components. So first one is early warning system and the interagency emergency response plan. The second is public awareness and community outreach. The third one is capacity building and um, medical professionals. So we trained and increased the capacity of medical professionals, reducing heat exposure and promoting adaptation measures. So these are the four simple components of heat action plan, and this was the first plan, which and the plan was very simple. We made the plan very simple so that everyone, a common people, can also understand the plan. And this was the first time that some in the that we used is a color coding early warning system, though it we use three color: yellow, red, and orange. Red is for extreme heat wave, orange is moderate, and yellow is to prepare. So this is the first time that someone has used a color coded system, early warning color system, and the heat action plan helped the citizen to increase the awareness. So this heat action plan, I will not go into the detail because the objective of this module is not only on the heat action plan. So if you want to know more about the plan, you can in the Google you will the heat action plan is readily available, so you can refer, or you can write to me. I can help you in getting that plan or answer any type of questions. So in 2010, we introduced the cool roof strategy as a component of heat action plan. This is a mitigation strategy. Um, in 2017-18, the city of Ahmedabad and Hyderabad initiated this cool roof pilot program. 2017, AMC unveiled the Cool Roof initiative as a part of the updated heat action plan, and we converted 3,000 homes to cool roof with lime to start with in 2017 and 18. A company manufacturing heat reflective paint donated to paint 10 to 15 pilot household, mostly in the slum areas. And dedicated IC, you can see this. This is a dedicated IC we developed on Cool Roof to increase the community awareness. So Ahmedabad, through the heat action plan, announced in 2020 target to cool roof 15,000 slum roofs and around 1,000 AMC building roofs. Due to the COVID, this could not be achieved in 2020, but we are planning to achieve this in 2021, to complete this by 2021. So there are several approaches for identifying extreme thermal events as listed on the slide. So first one is evaluating meteorological data against to establish criteria, that is threshold temperature, comfort indices, or historical distribution. So meteorology data, as I said, you can get from IMD, Indian Meteorological Department. They have the archive data. So to evaluate these, you need at least 10 years, minimum 10 years or 5 years data to see the to compare it and see if there is any distribution, or there is uh, any heat related events. So and then analyzing health impacts, and then combining meteorological and the health impact as data. So you can correlate both temperature and the health impact data. Health impact data you can collect from municipality, that from the register of birth and debt department, all cause data, because in India the cause specific data is not properly recorded, so there's gap. So you can use the all cause mortality data, and as we did in Ahmedabad, as I showed, or you can also see the ambulance data and hospital, government hospital data, and you can compare it with the meteorological data. So as I said, this graph is showing the thermal extreme based on the health impact. So the x-axis is a T max, means maximum temperature, and the y-axis is deaths per day. This is the Ahmedabad city data. So this is a more direct approach to identifying extreme thermal condition, um, compared with the health outcome data, and health outcome data with the meteorological data. So you can see the when uh, the maximum temperature is increasing, the death is also increasing. This is the summer Ahmedabad data. So this is how we decided the threshold for Ahmedabad. So from 41 on, you can see the from 41 to from 41 onward, uh, there's an increase in temperature and the death there. So we decided threshold based on this health and this temperature data. So 41 to 43 is we give yellow alert. 43 to 45 is the orange, and 45 onward is the red alert. So this type of graph can be used to identify the threshold for this early warning system. So for every city has a different threshold, because the temperature, weather condition, and the death is totally different. So every city can get the data and can do the simple analysis and can identify uh, the threshold for that city or the district. So this is we have evaluated the, as I said, the historical relationship between weather and the health outcome. So this is the daily all-cause mortality data to establish criteria for extreme weather conditions. So as I mentioned, threshold for Ahmedabad we decided at 41, 43, and 45 based on the all-cause mortality and this Tmax data. So we did not include the humidity because Ahmedabad humidity is less than 20%. But if the city is near to coast, they should include the humidity as well. So this slide is showing the temperature threshold for Ahmedabad heat action plan by using the following color signals that I mentioned. Less than 41 there is no alert. So 41 to 40, 42.9 or 43 there's the yellow alert, and orange is 43 to 44.9, and 45 greater than 45 degree is a red alert for Ahmedabad city. So there's also another method is by using the quartile method. If the mortality data not available or not properly recorded in that city or the district. So this is a, quartile method. So you can decide the threshold at 95, 90, 95 or 99 quartiles. So this is T max. So you can see there's no much, just not much difference, but if the data is not available, it is always recommended to compare it with the health data in case it is not properly recorded or not available in your city or district. You can use this quartile method. So, as I mentioned, there are two broad categories approaches to identify thermal extremities using uh, using observe or forecast meteorological condition. The fixed threshold criteria and the relative threshold criteria. So the threshold criteria is when the extreme thermal condition exists when the criteria are exceeded at any point of time. For example, the extreme heat if the temperature is more than 40, extreme cold if it is less than -10, temperature exceed as a seasonal distribution value, that is fifth or 95th percentile. The fifth is for cold and 95th percentile is for heat, extreme heat. A temperature threshold is associated with increase in adverse health outcomes. So you can also compare your temperature data with your health outcomes. Now the question is, who is the vulnerable to extreme thermal? Uh, so as a health professional, it is important that we have an understanding of who is vulnerable to health extremes. So let's look into that. This slide provides a summary of characteristics that epidemiological studies, physiological studies, and the studies of particular extreme heat events have identified as placing individual at risk of experiencing adverse health outcome during extreme thermal condition, particularly extreme heat. So generally any combination of factors that either increase exposure to high ambient temperature or limits either by physical ability to response to the condition or the type of response undertaken will increase the risk of adverse health outcomes. Uh, so there's all these factors which is associated to with increase in vulnerability are have references from as and is based upon the epidemiological studies and the physiological studies. As I mentioned, the first one is extreme age, so older and younger are the more vulnerable. Second is poverty, then the lack of technology and adaptability. Technology, you mean the cool roof facilities or cooling technology. low level of fitness, physical and mental impairment, social isolation, usually in the Europe heat wave, which happened in the 1995 2000, that 70,000 people in the 2003 in Europe died. And so mostly the older people who are in self social isolation, they were more vulnerable, and the death observed in them was more compared to other chronic health conditions. Use of specific medication, extended direct exposure to ambient heat or cold. So for example, the outdoor workers, you can say. Next, so there are wide range of options for managing the risk of thermal extremes. Some of them are I have listed in the slide. The first is the risk. I have categorized it into the risk factor and the risk management. The first is the lack of access to cooling. So the risk management could be the cooling in public facilities, change in urban infrastructure, or the cool roof, increase in the cool roof facilities in vulnerable places or in the slum. Then age, heat wave. So for age, the heat wave early warning system. So there should be a proper dissemination of early warning system. So all the age group people should know, should the message should reach properly, and they should know when there's a if there's a heat alert. The third is pre-existing health conditions. So social care worker network should be properly developed. And when if someone is having the pre-health condition, so there should be proper awareness should be given to them. So how they can contact the doctors, and when how they will understand this, there's a heat related illnesses, or there's some heat related symptoms if they have, so how they will approach for the medical facilities. So before it get severe, they should approach the doctor, and they can call the 108 for help if they are staying in self isolation. And poverty and isolation, urban green space should increase, so that the so that the poor and the vulnerable people can take rest, and the urban green space also help in reducing the urban heat island effect. So so the greenery is of course is helpful. So, factors increasing risk of thermal extremes in a challenging climate. So, in conditions, future health impact of extreme thermal conditions. So, it is important to recognize that anticipated trends will increase many of the factors that affect the risk of experiencing adverse health outcome as listed on the slide. So first is large population. The example is India. Larger elevated risk group, that is elderly, young, and poor, expect more and more severe extreme heat events. And the last one is may reach exposure threshold without adaptation. So the larger and the older people, with more individuals at increased vulnerability because of the chronic disease, obesity, and other health conditions. They are so they are more vulnerable to extreme temperature, and the outdoor workers, they are more exposed to heat. So, so there are a number of factors. will work to reduce the risk of thermal extreme. A major issue is with projecting future health outcomes from extreme thermal condition is that the nature and the effectiveness of future adaptation to these events is uncertain. Increase in standard of living, greater implementation of early warning system, response system, and adaptation responses can minimize the so there need to be a city or state specific heat adaptation plan that for example the Ahmedabad heat action plan that we develop in Ahmedabad. So you can also follow the national NDMA heat action plan. This is is a national guideline how to develop the heat action plan, adaptation plan for your city or for your state or for your district. A critical element of the success of these programs is how well any message or program activities reach to most vulnerable and how well these are taken by the vulnerable individual and communities. To for example, like anticipated increase in standard of living, early warning and response system, urban green space, infrastructure better designed for higher temperature, cooling in public facility and social care networks. These are the few examples that in Rajasthan, in one of the project we did in Rajasthan. So Rajasthan, we with the school children, we organize a heat awareness day. So India's first heat awareness day in 5th May 2017. You can see this is this how school children are participating. This picture is from Udaipur, Rajasthan. So heat related illness and prevention management awareness in school and children are the low hanging fruits. So you can to start with you can aware the children and the later children will aware their parents. In Ahmedabad also before summer before in summer during summer usually all the school in Ahmedabad, Gujarat and other places also are closed. So before summer in Ahmedabad, we distribute pamphlet and awareness pamphlets to the children. And we also organize training workshops in the school to create more awareness, and which is we have observed which is very useful. Coming to the fourth section, how do we access the health risk and impact of thermal extreme? We will focus on different assessment method in section 4. So, as discussed earlier, extreme health outcome are the appropriate measures for quantifying the impact of extreme thermal condition. A significant drawback is basing estimates of health impact attributed to the thermal exposure on the uh, those health outcomes coded as being attributed to thermal condition in as for example in ICD-10 codes is that they are generally believed to under account the relevant health outcomes. So outcome will be missed when for example the higher ambient temperature exacerbated a heart condition causing heart attack. So the health care professional would record the heart attack, but are highly unlikely to include the heat as a add a conditional factor, which because of the heat that heart attack has caused. So usually they will include the death is because of the heart attack, not the underlying heat condition. So using all recorded outcome and looking for the variation from the baseline level will provide a more comprehensive assessment for the total number of outcomes attributed to heat. So it is always recommended to develop and use estimates for excess outcomes instead of count based on listed medical condition codes for thermal exposures. Generate odd ratio and relative risk estimate for changes in thermal measures or combinations for meteorological condition, and conditions result that are generated, that is just by age of a person affected thermal by thermal threshold. So these are the few statistical examples that you can use for the data, or simply as the example I showed for Ahmedabad, you can use that. You can compare the meteorological data simply with the health data, and you can see how if there is a correlation or not. And to see the vulnerability, of course you can see the risk by age and by the pre-existing condition, but from my experience I am saying the data is very difficult, the health data is very difficult, but in case if you are lucky, if your district that the health data condition is really good, so you can use these statistical technique to see the relation. Air mass based studies approach the task of identifying thermal extremes and quantifying their impact by first categorizing weather into combination of characteristic distinguished mostly by heat and humidity level. So different air mass groups are then evaluated for their relationship with health outcome, with those having such a relationship being used to identify this thermal extremes. So air masses capture distinction in weather condition, multiply meteorological variables. Meteorological variables include your temperature, humidity, and wind speed. Map of air masses over a time period of interest. Um, so you can use a 10 years or 5 years data to do that. Compare health outcome by air mass with longer term average, and air mass with evaluated outcome rates may identify extreme thermal condition. So result of the analyze can then be used in early warning system based on the forecast weather data. So regression analysis, as I show few examples of Ahmedabad, can be used to predict the health outcome given conditions in an air mass. So you can refer the Ahmedabad graphs and figures to do this analysis. So lastly, let's look at the potential impact of thermal extremes on. So impact of Ahmedabad heat action plan. So element of success, early warning system and response system of thermal extreme. So the first is to build a strong city level engagement. As for example, in Ahmedabad, Ahmedabad Municipal Health Agency and the Meteorological Department, we established a strong city level engagement with them, a strong collaboration between health and meteorological service and implementing organization. The plan also, our heat action plan also identifies stakeholders at national and state and local level to ensure the active participation and effectiveness implementation. Also active participation is very important for the success of any plan. And the last one is develop strong network of stakeholder and the agency that play an important role in implementation of the plan. The second is develop a heat health early warning system. So I have given you enough examples and shown enough graphs. So how to develop the heat health early warning system? If the health data is not available, so you can also use the percentile method for your city. and the color code alert to prevent the heat illnesses. Communicated effectively the high risk vulnerable population in, for example, in Ahmedabad, we did it. So communications should be very, there should be well developed network. So the alert should reach to the vulnerable community and develop IC material in vernacular languages, provide clear advice of action to take and to avoid during the heat wave, know who and who were the most vulnerable people located in your area, help provide relief from heat. Then impact on in healthcare and other agency for the for healthcare, you can develop capacity building of healthcare professionals to recognize and respond heat related illnesses during heat wave. So you need to develop a proper SOPs that you will get in the NDMA plan, or you can refer the Ahmedabad one. So develop the heat response and action for each heat alert level and activities during period of heat. So during summer, but the activities need to be done to need to be now in each departments. Identify, resolve communication gap and weaknesses between participating department partners and the public. Implement technologies and strategies for mitigating the urban heat island effect. For example, in Ahmedabad, we initiated the Cool Roof program. And so, recognizing the potential of for effective program to minimize the future public health impact of extreme thermal condition elements for success of any plans is summarized in this slide. So, so provide opportunity to request assistant or evaluation. So after every heat season, the plan has should be evaluated to identify the gaps. uh, be creative in use of the available resources, short-term assignment changes for public sector staff, review response to evaluate to identify success and area of improvement. There should be always a scope or for the area of improvement in the plan. Revise the program as needed and the opportunity to change. So after the, as I said, after the heat season, you should evaluate the plan, and based on the evaluation, you should change the plan accordingly. To summarize the impact of heat action plan, so the heat action plan will help in reduction in all-cause mortality during the heat season, and also help in decrease in heat stroke cases and deaths in hospitals in your city. So, for example, in 2016 there was a massive heat wave in India, in Andhra Pradesh, and in many southern part, many people died. Ahmedabad also had a heat wave, but the all-cause mortality and the deaths was uh, is minimum in Ahmedabad because of the heat action plan. And you can see this in this graph. In 2010, the number of heat stroke cases were more, and also the death. But in 2016, as you can see, there was also a major heat wave, but the heat stroke cases and the death were comparatively was very less recorded. So this figure shows the historical and projected changes in heat wave in India by intensity, duration, and frequency. Um, Frequency heat wave are projected to be more intense, have a longer duration, and occur at higher frequency and earlier in years. Projection indicates that a sizable part of India will experience heat stress condition in future. Southern India currently not influenced by heat wave is expected to be severely affected by the end of 21st century. In North India, the average number of days with extreme heat stress condition during the pre-monsoon hot season could reach 30. The intensification of heat wave might lead to severe heat stress and which can result in increase in mortality and morbidity. So you can see these places where the red area, where you can see that how the intensity, duration, and the frequency of heat wave is increased. So it is a high time that to prepare a heat action plan and to alert so that we can save some lives. To summarize, so what we have covered in this module. So this module goal was to help you to start to think about what define an extreme thermal event, who is at greater risk during the heat, how should the health impact can be measured, and how climate change could affect the future risk. This is a time, and this the objective of this module to help you to think about all these things which we discussed in this. To finish off module 5, mm, Uh, so I will. This is the slide. This is the first slide that I shown you. Hope I have you understand. But the learning that I explained you that will covered in this slide. So to spend as we have completed the module 5, so I will ask you to spend few minutes looking over the notes and what I discussed and the key learning, all these learning that I have covered in this module, and the thing how you will develop the adaptation plan, and how you will calculate the threshold for your city and the district. And if you have any doubt, my email address is there in the first slide. Please free to ask me and to write me if you have any questions related to this module. And if you have the health data and you have a problem in calculating the heat health threshold, so you can also write to me. I will suggest you how to use the data, how to calculate, and how to analyze the data. Okay, so just go through these slides, and it will help you to develop to answer all the questions related to extreme thermal events. Hope you have enjoyed this module, and the next module 6 will be on extreme weather events. Thank you.